Systematic reviews published in JBI Evidence Synthesis are often used as evidence for practice and policy, so it is vital that these systematic reviews are of the highest possible quality. However, we tend to see issues which can reduce the quality. 4 main issues come to mind. First, while authors routinely describe in detail the outcome measures of interest for the review, there tends to be an oversight in stating the timing of the outcome measures. A good quality systematic review should pre-specify the timings of the outcome measure to prevent authors from being overly influenced by the findings reported in the study. Authors should ideally choose time points that are commonly agreed for the clinical area, rather than using the end of treatment or the end of trial, as this could introduce substantial variation between the studies. Authors are recommended to categorise the outcomes into clinically meaningful timings, such as short-term, medium-term and longer-term, and specify the range of timings that would fit within each category. Ideally, authors should also specify these categories as either primary or secondary outcome timings. The second issue relates to the detail that is reported regarding the synthesis approach used when a meta-analysis isn't feasible. This type of synthesis is conventionally referred to as a narrative synthesis, which is generally poorly described and therefore lacks transparency in exactly how the studies were synthesized. Recently, the terminology has changed to syntheses without meta-analysis, or SWIM for short, to clarify that a standard metric, such as a p-value or a standardized mean difference, will be calculated across all studies, which will then undergo a synthesis approach, which could include summarizing descriptive statistics using means and interquartile ranges, synthesizing p-values, or using vote counting based on the direction of effect. To enable transparency and replication, the protocol and the systematic review should provide a full description of the SWIM approaches used. Thirdly, the factors to be investigated in sensitivity and exploratory analyses using subgroup and meta-regression analyses tend not to be provided in the protocol of systematic reviews. Transparency in the factors which will be used to explore whether the effect size differs between subgroups needs to be reported a priori in the protocol. This is to guard against testing of many factors which could result in multiple testing issues. Additionally, the factors used to check the robustness of the review findings to limitations related to the included studies, assumptions or approaches to the synthesis also need to be reported a priori in the protocol. Lastly, the journal requires all quantitative reviews to assess the certainty of findings using the grade approach. However, there is a tendency for the language used in the interpretation of the findings within the results and the discussion sections of the manuscript to not align with the assigned grade rating. For example, the statement, "the treatment reduces the outcome," should only be used where there is a high certainty of evidence associated with a clinically important benefit, where the latter is assessed using the effect size from the synthesis. The language would therefore be tempered when the certainty rating is lower. For example, where there is moderate certainty, the statement should change to "the treatment probably reduces the outcome." Where there is low certainty, the statement should change to "the treatment may reduce the outcome." And the statement should change to "it is uncertain if the treatment reduces the outcome" for very low certainty. Additionally, the language regarding the effect size should be incorporated into the statement too, where tempered wording such as "the treatment slightly reduces the outcome" should be used for smaller clinical benefits, and "the treatment has little or no effect on the outcome" for those which showed no clinically important benefit.